Hey guys, what's up? So welcome back to Geeky Cardio. So this is my new video series about the congenital heart diseases. So this video is the first one, and it's going to be about the introduction of CHD. Let's get started. So to identify a congenital heart disease, we have to know four main features about them. First is whether the disease we are dealing with is making the baby blue or not. So whether it's a cyanotic one or an acyanotic one. And second is the pulmonary blood flow, whether the lung is immersed with fluid, so increased pulmonary blood flow is called plethoric lung fills, or if it is low, we call it oligemia. And if it is normal, we call it normal. Third is hypertrophied ventricle, means which ventricle is going to bear the brunt of a lot of blood. So that is left ventricle or the right ventricle. And the axis deviation, which is either left axis deviation or the right axis deviation. And there are these list of cardiovascular diseases which are congenital diseases. They're divided into acyanotic and the cyanotic ones. The acyanotic heart diseases, this is the list. This is very easy for me to remember because it's only like small words, right? So ASD, VSD, PTA, coa-PAPR, we call it PER. It's coarctation of aorta and a partial anomalous pulmonary venous return. Now ASAR, MSMR, PS. So AS is aortic stenosis and mitral stenosis and regurg, and PS is pulmonary stenosis, like that. And the cyanotic heart disease is right here. They can be remembered this way. So ET. So E stands for Eisenmenger syndrome and Epstein's anomaly, and T is TAF, Bata, Tapper, and Tag. TAF, Bata, Tapper, and Tag. That's how I remember it. TAF, Bata, Tapper, and Tag. So TAF is tetralogy of fallow pulmonary atresia, tricuspid atresia, total anomalous pulmonary venous return, and TGA is transposition of the great arteries. So all these things and these things can be remembered that way. And so this video series is going to consist of 10 points mainly. Will include complications can be included too. And so we need to know the point, one specific point about the disease, and these 10 points will be very much essential in diagnosing them and also to clear our boats. So yes, and this is the main physiology behind it. So whenever we get a murmur, it's either due to a shunt or a systole or diastole. So a murmur is a shunt murmur or a systolic murmur, a diastolic murmur. Okay, so I consider murmur to be a knock on the door, meaning it occurs before the valve is opened, usually before the valve is opened, and it's mainly due to a pressure difference. I mean, that's how I remember it. And second is the heart sounds, that is S1, S2, and all. That is due to shutting of the door, okay? So it's mainly because of the volume difference. So if there's one thing I want you to remember, it's this. So the heart sounds are due to the volume difference, whereas the murmurs mainly due to the pressure difference. So whenever there's a pressure difference, the left atrium and the left ventricle, which usually there is not, so there's no murmur. But pressure difference between the left and the right ventricles is a lot. So whenever there's a blood flow between the left and the right ventricles, there will be a murmur because there is a pressure difference. And whenever there's a systole and the valve is leaky, there is a murmur, right? So that's about it. See you soon.